When we are creating new methods to be able to bring in patients, to bring in more referral sources, it's a big challenge. A big challenge that is faced by every single home health agency, home care, or hospice company. And current trends makes this challenge even more necessary to be able to attract more good referral sources. It is getting very competitive out there. CMS has estimated that currently there are more than 10,000 home health agencies that are servicing the Medicare population. That is right, 10,000. And also depends on which state you are currently in. There are states where there are over 2,000 home health agencies. So most are small, most are local, or even regional providers. But at the same time, they have very limited capabilities, limited capital to be able to pay for the right promotions, for the right marketing strategies, for the right and also the right branding strategies for business. Know this, that as agencies look to more innovative ways to be able to be introduced and introduce their company, their services, their products to the community, as well as to other providers and of course patients. It is very important to know and consider the legal parameters imposed on the home health marketing strategies. Marketing of your home health company, your services, is highly regulated, both by federal as well as state governments. So when you guys have new marketers coming into your industry, especially if they're coming away outside from the healthcare industry, even with these new marketers coming to your company, they may not be aware of the ever-changing prohibitions on what is the right way of doing things and marketing in our industry. So what we are doing in this video series is to be able to help you navigate on the variety of different laws, the variety of different rules and procedures on how to be able to stay compliant. We're going to be talking about the anti-kickback statutes. We're going to talk to you about the Starks laws, HIPAA, as well as other local state laws that may apply to you. So let's go ahead and get started with several of the information here. Anti-kickback statutes. Okay, so let's talk about the Anti-Kickback Act. So the Anti-Kickback Act is a criminal statute in which it prohibits purposefully offering or accepting payments for Medicare, Medicaid, or any other government reimbursable health care referrals. So the Department of Health and Human Services Office of Inspector General was given this power around 1987 to actually exclude providers from Medicare for violating statutes. There's going to be civil monetary penalties that may be assessed to these agencies. Now, it is very common knowledge that providers are not able and should not pay anyone for getting referrals for services. But the statute that was created goes beyond just the simple paying someone for a referral. The anti-kickback statute prohibits any arrangement between a provider and another person or party where the main purpose of this arrangement is to be able to induce or to be able to gain referrals. To add to that, a payment under the anti-kickback statute does not include just money. Not just money or you writing them a check. It includes anything of monetary value. So a person who is potentially violating the anti-kickback statutes may exist in a variety of different arrangements, where that a provider Now the statute does provide what we call safe harbors. Safe harbors for arrangements that serve legitimate business purposes. The safe harbor exemptions includes the following: the space rentals for equipment rentals, agreements for employments, person and management services, discount arrangements, referral arrangements, and investment interests. The safe harbor does not give providers discretion to enter into legitimate business agreements, but rather outlines detailed criteria for specific agreements. Violation of Anti-Kickback Act can be found in marketing techniques as well as agreements outside the marketing scopes. We want you to be careful on what you do when you create agreements and make sure you discuss this with your law team. Some examples would be in completing a discharge planner for hospital patients or sponsoring luncheons for physicians. That's right. When physicians or their staff asks you to come in and bring in lunch, you can be violating the anti-kickback statute. So you want to be able to make sure that you look into the spending, what you're doing. At the same time, it can also violate it if you are entering into a contract with another agency to perform physical therapy services to patients on what we call sliding fee scales, pretty much based on the amount of services that is rendered. So, not like the Starks Law, the anti-kickback statute regulations, what it does is literally this. It does not allow any minimal exceptions. Therefore, even giving physicians donuts during routine visits can be considered a violation. To avoid these, home health agencies should establish a bright line rule where marketers are not to give anything of value when marketing their services. To add to that, when home health agencies enter into arrangements with third parties, whether it be for leasing the space or for therapy services, for referrals, or even billing services, they should always draft a written agreement. No, not just using your word as your bond. Have a written agreement that fits into a safe harbor exception of the anti-kickback statute. The Starks Law 2 regulations prohibits physicians from referring Medicare patients to an entity with which the physician or the member of the physician's immediate family has any financial relationships, unless there's an exception that applies. When we are talking about a financial relationship, it includes owners or a compensation relationship with a designated healthcare provider. So a compensation arrangement is pretty much any arrangement which can involve remuneration between that position and a designated entity, between that position and another company or another person. Unlike the anti-kickback statute, the Starks Law is not a criminal law and only pertains to referral relationships between the providers and the physicians. The Starks Law does not govern a provider's relationship with a hospitals, with the suppliers, or non-physician professions. The regulation has clearly established restrictions that upon physicians referring patients to entities in which that physician has a particular interest. Now, Starks Law can become an issue in several other situations. Let's talk about that. It is commonly an issue in developing an advisory board or contracting with a medical director or with a medical director or physicians group, where physicians have direct lines with patients and director care, and drafting arrangements or agreements with physicians requires a lot of caution. There's a variety of different rules that can apply when that physician is an employee of an agency like yours, or when that physician is an independent contractor of a home health agency. Let's talk about a medical director. A medical director agreement can actually fall the management and services exception if that agreement is in writing and if the compensation of what they will get is set in an advanced fair market value. Remember, a fair market value. Now, however, like any exceptions under the Starks Law, in order for an arrangement between a physician and a home health agency to be actually lawful, this arrangement must also be in accordance with the anti-kickback statutes. Some payment arrangements set in advance at a fair market value may not be in the boundaries of the law if one of the purposes of that arrangement is to actually induce a referral from that physician.